Assalamualaikum. This is Dr. Ahad Adnan. Today in this video, I'll show you 20 pediatric X-ray which may be found in our daily practice as well as OSP examination. So let's start. The first X-ray. This is X-ray skull showing thinning of inner and outer table and widening of diploid space. There is hair on end appearance as well. So diagnosis is thalassemia. X-ray of wrist joint may be given with or without age. You may be asked to find out bony age. As we know, fourth carpal bones appears in between 3 to 4 years and 4 years, and fifth carpal bone appears in between 4 to 5 years. So bony age of this X-ray is 3 to 5 years, but actually the age was 12 years, and when the age is given 12 years, so there is definite delayed bony age. One of DD is hypothyroidism. X-ray nasopharynx shows enlarged adenoid, which gave pressure to air column, causing thinning like a thread. There is obvious cardiomegaly, which should be confirmed by measuring cardiothoracic ratio, and the DD may be heart failure, pericardial effusion, or cardiomyopathy. A child presented to us with bowing leg. We have performed a X-ray wrist joint as there was a widening of the wrist, and we have found there is cupping and fraying of metaphysis and widening of the growth plate. So diagnosis was rickets. Another child presented with bowing but no change in the wrist, and here you can see there is angular deformity, metaphyseal breaking, and wedge-shaped epiphysis. Diagnosis was Blount disease. X-ray of a neonate showing free air just below the diaphragm bilaterally. Diagnosis was pneumoperitoneum, and cause was perforation of the gut. Chest X-ray shows right-sided consolidation with large nematocele in large nematocele, and the interesting thing is the shape. Whenever you see a wedge-shaped consolidation in the right middle lobe, you may think right middle lobe syndrome, like that. In next 3 X-ray of a same child, will direct to a final diagnosis. Here in this X-ray wrist joint shows distal tapering of the phalanges and proximal tapering of the metacarpals, giving rise to a bullet shape. And X-ray span shows a ovoid lumbar vertebral bodies with ventral beaking and oar-shaped ribs. And chest X-ray shows oar ribs and a short and stout clavicle. So diagnosis is mucopolysaccharidosis. Large dense radiolucent shadow devoid of bronchovascular margin, and there is pushing of mediastinum to opposite side, that is to left side. So diagnosis is right sided pneumothorax, and there is left tiny pneumothorax, and there is no very obvious shifting of the mediastinum, and this is the repeat X-ray of the child after proper treatment. So there is excellent prognosis. There is a left upper radiolucent shadow without any bronchovascular margin, but in mid and lower part there is dense homogeneous opacity, and there is obliteration of cardiophrenic osteophrenic angle, and mediastinum is pushed to right side. So diagnosis was left-sided hydropneumothorax. Here you can see air fluid level inside a cavity in left lung. So diagnosis was left-sided lung abscess. There is you can see dense inhomogeneous opacity in left lower chest, and which is intervened by gut shadow inside the chest. But you can see there is not any obvious shifting of the mediastinum, but the diagnosis was congenital diaphragmatic hernia. This is an interesting X-ray. Prone barium gastroesophagogram was done, and you note the content, that is the contrast particle which was introduced through oral cavity, raised air column in the trachea or in the distal parts. So diagnosis was tracheoesophageal fistula. This is a left-sided massive proliferation before treatment and after complete treatment. And this is extremely rare finding. Do you see any obvious changes? Well, there is beefed lips, and this CT shows butterfly-like hemipatriva, creating scoliosis. So this rare diagnosis was Jarko-Levin syndrome. So thank you.